I saw the first thing about coronavirus on the news in early January, and that's when we had less than 1,000 cases worldwide, and most of it was still in China. I immediately reached out to our infection prevention team and said, is this something we need to be meeting about? And so we started quickly coming together as a small group just to talk about what the impact would be. And knowing that highly infectious disease spread quickly, we wanted to make sure that we were planning internally for this, even if it didn't turn out to be anything of note. As we've seen it's grown quite quickly. So our Emergency Operations Center, or Incident Command Center, is here at the Miro Center. We've been set up here since March 4th, kind of proactively to assess what Parkview's impact will be with COVID-19. We have about 25 people here, and we have leaders coming in and out throughout the day for collaborative sessions on putting multidisciplinary groups together to make sure that any barriers that come up with potential treatment options, with surge capacity, with anything that surrounds COVID-19 from an impact perspective, that we have people that are getting together both virtually and face-to-face in order to solve those problems quickly and be able to serve our community better. And we've really tried to go virtual with a lot of our meetings because of social distancing. So we've moved into the Grand Hall, which gives us a lot of space to have at least 6 feet between us, and everyone has their own table there. So we're doing a lot of environmental cleaning just because of that, because we don't want anyone to get sick here. So we have several senior leaders here, as well as operational staff that are manning the center 24 hours per day. We have clinical desks that can answer all of those tough questions on testing and just what we're seeing with COVID-19 around the country right now. Surge is becoming a big issue. So we're working constantly on surge capacity, and we're working on the 3 S's of that, and that's staff, stuff, and space. How much space do we have? Do we have the right equipment? Do we have the staff to properly and safely care for people in those spaces? So we're working really diligently on that from a system perspective, not only for the Regional Medical Center, but how do the community hospitals fit into this plan as well? And how can we best support all of those functions from a system level if we do see surge here in Indiana, that we want to be ready for that. We've had plans for this, and now it's time to really test them. And we've had a good opportunity by proactively opening our command center to not only strategically plan as we have in the past, but now tactically plan and see how we can actually put that into place. So we're really positioning ourselves in a good way to support our community through this pandemic.